Very good morning, everybody. Happy World Optometry Day to everyone. And what can be better today? What we're going to learn is a complete evolution of certain procedures, what we have seen through the years. I'm of the generation where I'm talking about perimetry as a Jerem's perimetry. And then we went on to listers. Suddenly we saw the Humphrey and the automated perimeters coming. The Jerems and the Lister's perimeter were dumped and they lay in a museum. And now what we're going to see is, as my generation, a third evolution in the whole process of perimetry. And we are very fortunate here to see these benefits, not only for our profession, but to the whole community that is going to take advantage of this new evolution or AI-based perimetry. So I'll begin with how I got involved into it. So I'm a practitioner. I have my journey through hospital and then academics and then my journey as a practitioner. As an independent optometry practice, I could never afford to invest in a perimeter. I'm a primary eye care practitioner and I screen for glaucoma. But there are certain times when you really need the perimetry. I also come across patients who have been diagnosed with glaucoma and we see them for 4 years, 5 years, there is no perimetry test that they have gone through. And a very simple explanation every patient gives is, whenever I go back to the hospital, of course my doctor would majorly most of the time continue with the same prescriptions, but I undergo the investigations which caused me a huge package, something like 9,000-10,000 rupees on a routine 6-monthly evaluation. So there's a big dropout on even of those people who can afford, but they think the costs are too high to just go back and get those medicines repeated again. We also find patients who have the inconvenience of going back to the hospital, or they have mostly the glaucoma patients are elderly patients. And these are the patients who depend upon their family, their children, to take them back to the hospital for that perimetry test. And so the compliance is mostly very, very poor. The third thing that we find is that patients are not comfortable in doing the test itself. I remember when we were doing perimetries in hospitals, we would even have some patients who would faint out. It was such a tiring procedure for many of the patients. And if I talk of elderly, it was very boring. They were not interested in sitting down for those 20-30 minutes pressing those light buttons. The reliabilities were poor. Now, all these barriers, challenges, I'm sure you all must have come across in your practice. There's a lot more to talk, but of course, we are here to learn new things and how all these challenges will be overcome. The second reason that we are doing it on the World Optometry Day is you'll all find something in your practice to be adding up. It might change your whole practice management and your economics when you deal with these perimetries. And I was fortunate because I one day had one call. All this story began with my introduction today to Atul, who was, of course, known to me as a junior from AIMS, who calls me up to talk to me about a meeting with Dr. Simon and something about all this, which I had I would say I was aware of it, but not exactly knowing what all this process is. So I was one of the fortunate ones who got exposure to meet Dr. Simon and then actually understand that this is something which will be coming to India. And it is brought to introduce you. We have Mr. Atul Puri, who will come back to you later at the end, who's the CEO of Omnicare, who will be bringing over this to you. And yes, one of the biggest day that I had when I met Dr. Simon and Dr. Janice. We had known Dr. Simon as a name, research papers, and we were surprised we were meeting it. With me today, of course, now is Dr. Anita Arvind, who is my co-founder of Learn Beyond Vision platform, through which you all are here, which is an education platform. And without wasting much time, I invite my friend Dr. Anita to introduce Dr. Simon to the audience.
Thank you so much, Monica ma'am. It gives me immense pleasure to introduce the speaker of the day, who is none other than Dr. Simon, who has invented the online perimeter by the name Eyeonic. So Dr. Simon is an Australian glaucoma subspecialist ophthalmologist. He is an associate professor at the University of Melbourne and Royal Victorian Eye and Ear Hospital. Dr. Simon is the founder and inventor of Eyeonic, an Australian software company that provides visual field testing on any computer or tablet. With over 40,000 tests performed and 13 research papers validating a similar accuracy to conventional perimetry machines, Eyeonic holds promise to improve the usability, accessibility, and affordability of perimetry services globally. Dr. Simon is the past president of Glaucoma Australia and is actively involved in World Glaucoma Association. In 2015, he wrote an authoritative textbook on ocular and visual physiology that is adopted as a core textbook by the Royal Australian and New Zealand College of Ophthalmology. Dr. Simon is an internationally recognized clinician and researcher with over 70 publications. A strong advocate for patients and their quality of life, his research has led to the development of online visual field testing through personal devices. Dr. Simon is a skilled computer programmer well versed in Python, JavaScript, and cloud computing. Over to you, Dr. Simon.
Thank you, Anita and Monica. It's my honor and privilege to be here, and I'm very pleased to be talking about the online perimetry system Eyeonic and some of our research. So thanks for the kind introduction. So Eyeonic provides online perimetry, visual field testing that'll work on any computer or tablet. The idea is that it's hardware independent. So it is software that is designed to work on any computer or tablet and provide consistent, repeatable clinical perimetry for you to use as you would use a conventional perimetry machine. Now we know that glaucoma prevalence is rising globally, and these numbers are increasing, predominantly in Asia. And we also know that sadly, most glaucoma around the world is undetected. And there's a few things to note about these numbers. These numbers represent the proportion of glaucoma patients that are not detected. So the first thing to note is that they're all high. No matter where you are in the world, most glaucoma patients are not detected. That's the first thing to note. And the second thing to note is they're unequal. There are clear differences that some parts of the world have, unfortunately, a much higher rate of lack of detection than others. And the question is why? And the answer is very complex. It's to do with many, many factors. But one of them, I'm sure, is access to the appropriate diagnostic services and affordable, accessible visual field testing for glaucoma assessment, I believe is one of these factors. And we have to remember, I know we all know this, but we have to remember that people who are undetected, people with glaucoma who are undetected, these represent people who are slowly losing vision that don't need to be, that we could be doing something to stop them from losing their vision if we knew that they had glaucoma. Now, a lot of people are interested in screening for glaucoma. Population screening for glaucoma has been talked about for decades. And I think it's fair to say that no one has really cracked this yet. No one has really come up with a great way of doing population screening. And these are the sorts of things that have been tried and used: pressure checks, genetics, fundus photography, visual field testing on machines, targeted or wide programs. It all comes down to very practical measures. It comes down to, yes, the diagnostic method, but also things such as cost, logistics, equipment, travel. I would argue that screening doesn't work with yesterday's technology, but that doesn't mean that screening doesn't work for glaucoma. That just means that yesterday's technology couldn't do the job. But I believe that the technology that's coming now, that's around the corner, AI-based technology, including online perimetry, can really make a difference here. So let me talk about Eyeonic, a cloud-based AI-powered platform that performs visual field testing. As I mentioned before, it'll work on any computer, any laptop, desktop, tablet, and it does all the things that you would expect a visual field system to do. 24-2, 10-2, 30-2, even binocular driving similar to the Estimate. It uses circular flickering targets, and it's quite intuitive and easy to use. I'll show you some examples later. The test guides the user through, so it's relatively convenient. And the webcam monitors them during the test involving facial detection. It's sensitive, accurate and consistent, and it allows home monitoring. So this is how the test works. We've spent a lot of time and thought about the basics of perimetry, the basic visual physiology of perimetry, and restructuring that to do the job of working on any computer or tablet, despite the variations in size, brightness, etc. And this is what we've come up with. The star is this spinning target, which is a little bit, that's the fixation target, a spinning star, and that's a little bit easier to look at than a non-moving LED light, and so fixation's easier. Now, I'm personally very interested in why patients don't enjoy visual field testing. What is stressful and unpleasant about it? And one of the things is that when they start, they don't know how much longer there is to go. They're kind of stuck in it. Well, we have a progress bar so that people know exactly how much is done and how much there is to go, just like when you download something. And also people can pause the test and come back to it with no problems. The test targets are these large contrast-based targets. So we're used to standard automated perimetry has tiny white or grey pinpricks of light on a dark background. But on Eyeonic, we use larger targets. They're contrast flickering targets, sinusoidal targets, and they do the job of providing consistency despite differences in monitors. Now, the star itself moves across the screen, and that allows patients to sit at a comfortable viewing distance. And one of the jobs that the test does is it finds the blind spot. So, as you know, we all have a blind spot, and the test, before it starts measuring parametric sensitivity, it detects the blind spot, and if the blind spot is too far to the side, it means the user is too far away, and it asks them to move closer. Now, the app will measure the size of your computer or tablet and tell the user where to sit accordingly, so that viewing distance is unique to every monitor, and it achieves a consistent viewing angle, achieving consistency of perimetry. And also the user is monitored by the webcam during the test, and that monitoring makes sure that the face doesn't move. So if the face moves forward, back, left or right, the monitoring will pick that up and tell them to reposition.
Your test is about to begin.
So this is an example.
Please close your right eye and look at the star at all times. Press space or click the mouse when the target appears.
So you can see the star starts in the top corner, and the star will move to all four corners, testing one quadrant at a time. And as I mentioned before, the first job is to find the blind spot, and once the blind spot is detected, the test can continue. So now we've detected the blind spot.
Move a little closer to the screen.
What's happened there is that the AI has detected that the person's head has moved, and then the star went from yellow to blue, the test paused, and it only recontinued once they'd moved back into position. Now you can see that the test is talking to the patient both through audio and also written cues, and one of the advantages of that is you can translate that very easily into many languages, and that's what we've done. We already have 25 languages and growing, with 5 for the Indian subcontinent specifically.
Your test is आपकी परीक्षा शुरू होने वाली है. कृपया अपनी दाहिनी आंख बंद करें और हर समय स्टार को देखें. लक्ष्य दिखाई देने पर स्पेस बार दबाएं या अपने माउस पर क्लिक करें. स्पेस बार दबाएं या प्रारंभ करने के लिए क्लिक करें.
Now I hope that Hindi is okay, but people have told me that it's good. So you can see that we can, I know that there are many languages in the Indian subcontinent, and we can cater to several of them. And, you know, there's a growing list. If someone really wanted an extra language added, we could do that, because we believe passionately in making perimetry usable, enjoyable and comfortable for patients. It will make your lives easier and it will make their lives easier, and it will lead to more accurate results. So we've done a lot of research validating the test and comparing it to conventional perimetry machines. And here's just one example of one of my patients in my clinic, and he's come with an external Humphrey visual field test, and he's also had the Eyeonic test performed. And you can see how similar the results are, where this patient has got this predominantly superior nasal defect and a small inferior nasal defect, both on the Humphrey and on the Eyeonic, with similar visual field index, 84 and 85%, mean deviation and pattern standard deviation. And yes, the Eyeonic system measures fixation losses, false positive, false negatives. One common misconception is people think, oh, because it's on a computer screen, it's not a serious visual field, it's not a proper visual field test. It's some kind of gimmick or some kind of quick screen, but that's not the case. It does everything that a conventional perimeter can do, except it's faster and more enjoyable for our patients. And it can also provide progression analysis, and you can see this is one patient who's had a lot of visual field testing done both on the Eyeonic system and on the Humphrey due to research purposes, and you can see that there's agreement not just in the individual tests, the two baseline tests on the Eyeonic and the two baseline tests on the Humphrey, but also the progression is clearly detected by both systems. And so it's a very useful thing, not just for detecting cases, but also for meaningful progression analysis over time. And you can see this picture, this man in the purple is my former PhD student, Dr. Tung Hoang, who is an ophthalmologist in Hanoi, Vietnam, and we've done a lot of research in Vietnam, and that was the subject of his PhD, and he's now using the Eyeonic test, enjoying it, and now performing ongoing testing in neuro-ophthalmology patients. So as I mentioned before, there's a lot of research that's been done. Here's some examples from it. You can see that here are just some individual cases, normal, early glaucoma, moderate glaucoma, and the similarities between the Eyeonic printout and the standard printout in terms of detecting scotomas. When we did a large study of 230 patients, half normal, half with glaucoma, and looked at the sensitivity and specificity, we found very similar sensitivity and specificity with the Eyeonic system compared with optic nerve OCT, macular ganglion OCT in the standard perimetry machine. In other words, it was just as good at detecting and diagnosing glaucoma as those large machines, except it wasn't a large, expensive machine. It was an app that will work on any computer or tablet. And one of my passions, as I said before, is the user experience, what it's like to have perimetry done. And I firmly believe that the Eyeonic system is a more enjoyable process for our patients. But that's not just what I say. There's data to back it up. And this study on the left shows 100 patients who've completed surveys comparing the Eyeonic system to the standard system. And you can see 8 out of 10 items is consistently, significantly in favor of Eyeonic. And when asked one question, which do they prefer, 84% prefer Eyeonic to standard perimetry. And what's interesting is this study has been replicated in many countries, in Australia, in New Zealand, in Vietnam, in India, in Israel, consistently a strong preference of patients Eyeonic over the standard perimetry, and in children as well, who also strongly prefer Eyeonic to the standard visual field test. Now, test-retest stability is a very important metric for any diagnostic device, and this is what we published in the Journal of Glaucoma in 2024. And here's an example of someone who's not progressing with very stable visual fields, as you can see, 2 baseline and the final test. And she's had lots of visual field tests along the way as one of my research patients.
Nhấn nút kích hoạt kích chuột khi vật tiêu xuất hiện.
As I mentioned before, we've done a lot of research in Vietnam, and you can see what great data we get. We've done clinical data all around the world now. We've data from LV Prasad in India, which we're just close to submitting for publication. And we've also got data from Nigeria, data from Brazil, many countries around the world, and we're always getting these similar sorts of results. R-squareds 0.8, 0.9. In other words, strong correlation between the Humphrey and the Eyeonic, both in clinic and at home. And as I mentioned before, this is our Vietnamese data. We also have done home monitoring data. Now, online perimetry offers the concept of home perimetry, which is very interesting because this is applicable in some parts of the world, such as where I am in Australia, where a lot of people have to travel far distances and they may not be able to see the doctor every time. And doing a visual field at home and then me reviewing the results by email, that is something that really happens. And you can see how accurate the home testing is and how really things don't change whether they're doing the test in clinic, the baseline, or over the 6 weeks at home. And, you know, what Monica was talking before about, you know, the possibilities of AI, it's true. I mean, one of the things that amazes me is that I'm at home, I get an email on my iPhone, one of my patients has done a visual field test, and I can look at the result on my iPhone while I'm at home. And to me, that's really exciting. As I mentioned before, we also have a binocular driving protocol similar to the Estimin, and we validated this against the Estimin. Now, this is a super threshold perimetry test. Most of our perimetry tests is threshold, similar to what you would need clinically in one of the conventional machines. But the driving test is a super threshold for driving license assessment. And you can see how accurate and how much it agrees with the Estimin machine, both in terms of Pearson correlation and also in intra-class correlation and test-retest repeatability. This is a study that's come out of Ghana looking at patient anxiety during the test. And you can see that when patients did the standard automated perimetry, the anxiety went up quite substantially during the test, while that rise in anxiety was much lower with the Eyeonic system. In other words, online perimetry appears to be robust against patients' innate tendencies to be anxious during visual field testing. Now, a lot of people might say, well, how can you achieve consistency despite different computers? Every computer is a different shape, different size, different white tone. And again, this is not just my opinion. We've published on this. It came out in an Indian journal, Journal of Current Glaucoma Practice. And this is my patients who did the test on 3 separate non-calibrated computers. And despite doing it on the 3 different computers, the results had a very high correlation, 0.96 to 1.0. So I'm very excited about where we are now. As I mentioned, it's being used all around the world. It's been used successfully in 2 major hospital networks in India and also some major optometry retailers in Australia and by the NHS in the UK. We were founded in 2019. We've raised capital in Australia. 13 papers, actually 14 now. We just had our 14th accepted, and we performed 40,000 tests in 14 countries, and along the way have won both scientific awards and business awards. Now, before I go on, I'll just stop sharing for a moment and open the floor to some questions.
So, Dr. Simon, we already have a question for you. So this is from Preeta. She wants to know, how does the patient performing the test at home respond on seeing the target using a joystick or laptop keys? Visibility or identifying keys in the dark may be a problem.
We tend to use spacebar or left mouse. That's how it works, and they seem to be okay at it. Some computers have sort of a light screen behind it. And the other thing is, remember I showed you that the background is actually not dark. The background is a light grey, and the targets are darker on a light background. And we deliberately do that so that the monitor is actually the brightest light in the room. So it's not done in complete darkness. There's always some light. And that's one of the advantages of the test. You don't necessarily need a sort of secluded dark space like you do for a conventional visual field machine. In fact, one of the studies we're doing at the moment is screening for glaucoma in Australian pharmacies, and the pharmacies can't get the lights down because they need to keep working. They've got customers coming in and out, and we're still able to do the test properly. So it's not completely dark, and they can see fine at home.
Specification of the computers, is there something specific we have to say that the patient who's doing at home need to have this kind of versions also, or is it any system?
Look, on the website, there's a manual, and the manual goes through all the hardware specifications. But I think as a rule of thumb, it will work on most current computers. I mean, if you've got something from 10 years ago or 15 years ago, you might have problems. But most computers that people have today, it'll work fine.
Thank you. Anita, you'll take up the questions. We have lots and lots adding.
Sorry, just one more thing. It's good to have a webcam. That's the important part. So a lot of computers that we use in my clinic, they didn't initially have a webcam. So it's quite cheap to buy a webcam, and you can sort of clip it on the top, and that's not a problem.
Thank you.
So there are a couple of comments and questions as well, Dr. Simon. One of it being, what about the follow-up examinations? Does it give a comparative analysis? And if we have to look up older tests, how do we do it?
Yeah, sure. So I will, to answer that, I'll go back to sharing my screen, and I'll just pull up the next test, next slide, because I think that answers it. So this is an example of the progression chart, which I think you're asking about. Does it do progression analysis? And the answer is yes, but you have to do 3 tests. So if you do 3 24-2 tests on the same eye, the option to see the progression will automatically pop up, and it'll be very easy for you to look at it. And you can look at the individual test results, or you can look at it as a progression analysis like this. So it's pretty straightforward and also useful. I can tell you that just because I use the Eyeonic system myself in my clinic. I've got a busy glaucoma practice, and I used it to decide a patient needed a trabeculectomy because he came back 3 years in a row. His visual field is clearly progressing, and yeah, we're doing a trabeculectomy. So it's clinically meaningful and useful.
So, Dr. Simon, is it required that we need to monitor the patient when they are performing this online perimetry, or is it fine that the patient does it at home and we get to see the reports, or we get a notification on our system that a particular patient placed in so and so place has done this test and we get to see the results? Or is it that we need to monitor while they are performing the test?
Yeah, it's a good question. So what I would say is that, well, what we do in my clinic is the first time they do the test, they do it in clinic under supervision. Because I think that it's always good for the first time someone there, an orthoptist or an optometrist, to teach them how to do it. But then after that, they're okay to do it at home. And I have a lot of patients who, after they've learned how to do it in my clinic, and are doing it once a month at home. Admittedly, that's through research, because home visual field testing is not yet approved in Australia. It's just too new. And, these things take a while to get into the, the payment strategies. But yes, when patients do the test at home, I get an email saying your patient has done a test, and I can I can follow the links and look at the tests very easily. In fact, I'm happy to sort of demonstrate to you how that works. I'll pull up the app, and it's very easy to, you can find it through the web browser very easily. And the first thing you see are your patients. Now those with the red dot are ones that have already done a test. Maybe they've done a test at home and they go to the top of my list. And as I said, every time one of them does a test, I get an email. And I can show you that these are the tests that patients are doing. And these are the results. It normally takes about 3 minutes. And I can look at the individual results, or I can look at the progression analysis. And you can see this is one of my patients that does a lot of tests at home, and essentially she's not getting any worse. So I hope that answers the question.
So, Dr. Simon, there's a question on, are there any limitations of this online perimetry?
Yes, I think that if someone needs to have a visual acuity of at least 636 to do the test, so if their visual acuity is not so good, then I wouldn't do it. Also, I think someone needs to have a degree of familiarity with computers. You know, if people have never seen a computer before, then they might find it a little bit challenging. And that's about it, really. But I'll just show you something else. So one thing that you could send the patient an email to perform the test now if you wanted them to do that. These are the instructions, and I think it's really important that you and your patients comply with them. One of the things is that it's important that they wear their glasses for reading. So the distance that they do the test is similar to what you would read. So a lot of the trouble that patients have with this test is because they're not wearing the right glasses for their presbyopic correction. So it's important that they do that. As I said before, the room doesn't need to be completely dark, but it's good to avoid light shining directly on the screen or on the eyes. As I said before, the app will tell you at what distance to sit, and it's important to sit at that right distance. Although if you're sitting at the wrong distance, it will move the patient in or out based on how it finds the blind spot. And to have speakers, because sound is used during the test, and it's easy to adjust the tilt. It's also important to follow the calibration rules. So it's asking me to increase the screen to at least 75% and make sure that you can see 3 different targets. If you're not seeing 3, if you only see these 2, then maybe your screen is not calibrated correctly and maybe you need to improve the color setting or the contrast so you can see that. Once you have that, you can see that one thing that I wanted to show you is, in terms of limitations, is that most people do the test setting with a normal size star. But if you have a patient with, say, macular degeneration or some kind of reduced visual acuity, and if their visual acuity is not better than 6/15, you can change them to have this larger star. And that's an easier target. And a lot of my patients are like that because a lot of my patients are elderly, they might have maculopathy, and they really are able to do good quality perimetry despite that in this low acuity mode. So I hope that answers the question, and if there are other questions, I'm happy to answer.
Yeah. So one thing is how if we are doing a screening process, what is the average time required for each eye?
Yeah, so a normal test takes about 2 to 2.5 minutes. It can be longer, probably it's say 2 to 3 minutes for a normal test. And if it's an abnormal test, it can be, 4, 5 or 6 minutes. And that's per eye.
Excellent. That's excellent compliance.
What would be the impact of pupil size and room illumination on the test results? And also if there is a particular time of the day that this test needs to be performed, morning, evening, afternoon, is there an ideal time, or for subsequent tests, is it to be performed on the same time of the day as the earlier test?
Yes, so time of day doesn't really influence it, except if you can't close the windows. So if you've got light streaming in at dawn or at dusk and it's coming straight onto your computer, then that could be a problem. But if you can close the blinds, then the time of day doesn't matter. And I think the other question was darkness of the room. As I mentioned before, one of the advantages of this test is that the background is bright. It's a sort of pale grey screen in the background, and that means that the computer is actually a significant light source in the room. So you don't need to have a completely dark room. As long as you just don't have a completely light room, it should be okay. And as long as you don't have like a lamp sitting right next to the computer shining onto it.
Dr. Simon, you mentioned that the patient is to wear the reading correction. So does it make a difference if he or she is wearing bifocals or progressives instead of just the reading prescription?
Yeah, that's a very good question, and that comes up a lot. And look, I think it's not ideal if they're wearing bifocals, but it's okay. So we have a lot of patients that, you know, they've got bifocals or progressives and they just wear them and they do the test and it goes really well. So, so that's fine. I know we're all used to the machines where you get one of the trial lenses and you put it in there. But the way we do it is people just wear whatever they wear for reading and it seems to work okay. And one of the reasons is because the targets are much larger. They're those contrast-based targets. And so I think they're less affected by these sort of fine degrees of refraction.
Questions regarding what about errors like false positives, false negative, fixation errors and reliability. I think you did cover that, but if you could just take us through again.
Yeah, let me just share my screen again. So look, the thing about perimetry is it's a subjective test and people, you know, no one's perfect. So this is an example of someone who I just found this, who's done the test and they've got a high false positive rate. And so because of that, it says low test reliability. And the same thing, if the fixation loss was high, it will get low test reliability. Now, my only caution to you is that if you see low test reliability, don't throw out the test. Don't say this is a useless test. It's actually still a useful test. And I think sometimes we put too much emphasis on the reliability. I mean, I think it's important, and it means that the results are not as fine-grained, you know, point by point, decibel by decibel. But if you stand back and get the big picture, it's very much unchanged. The other thing that you might note is that this says false negatives NA, and you might remember that if I go back and if I just do this, and I'll turn that back to a normal size, one of the, you know, there's lots of different options down here, and one of them is you can turn false negatives on or off. Now, a lot of the more modern algorithms don't have false negatives because it makes it faster. But if you want to include false negative checks in there, just turn it on and it'll take probably an extra 20 seconds or so to do the test.
I think it's still worth in estimating, screening and picking up and the time. And you rightly said that if we have the first time for our patient doing it in the clinic, and then of course they can continue to do home-based.
Dr. Simon, I have a question. I just noticed that the star color mentioned gold. Do we have other options? And if there is, why would we have options of changing the star color?
Oh yeah, so you can change the star color. Look, I think that's not important clinically. That's just about making it just a more enjoyable experience for some patients. That's all.
Okay, thanks.
I think lots of appreciations coming in, questions are still coming in, and the group that we have created.
Wanting to know the cost to the patient and subscription and all of it.
I would like to invite Atul for that. So Atul is the CEO of Omnicare, which is going to be helping you with it. Atul, if you can come live and just let people know about the questions about the costs and other things.
Atulji, people want to know how do we go about subscribing this and what would be the cost of per test to the patient and how we can incorporate them into our practice.
Namaskar everyone. At the outset, I would like to wish my fellow optometrists a very happy World Optometry Day. I would also like to thank Dr. Simon for his address and for sharing his knowledge with all of us. My sincere thanks to Professor Monica and Dr. Anita as well for making this possible. As you are already aware, the cost of VFA test is around 3,000, 3,500 or 4,000 rupees. Depends upon clinic and the hospital. We are able to offer this test at 1/3 of the price to the patient. This is possible without investing in the instrument. I think nothing less than 25 lakh. As the CEO of Omnicare, I am pleased to offer this service at very nominal cost for the benefit of people at large. This service can be an additional revenue source for my fellow optometrists. And for any inquiries, further details, you may get in touch with me, my team members, and I will be happy to help you. Thank you very much.
Yeah, thank you. I know I see a lot of opportunities that, as I said, as an optometrist, it is not easy for us to invest in just a perimetry test. And we do screenings and other things. Besides this, we can monitor our patients with glaucoma, home-based. I think it's more time that we can have an additional practice business add-on if you just invest in this, and you can have your patients flow into it. Telemedicine is again something where optometry is evolving in, and this is, I think, a big thing for telemedicine too. So, Janice, you would also like to say something?
Good morning, everybody. First of all, thank you so much for once again for arranging this session, and thank you very much to Simon again for the presentation. Both Simon and my details are available on the screen. And as you've mentioned already, and Dr. Atul has mentioned, please do reach out to him with regards to the subscription and access. What is with respect to initially registering, I do encourage you to use the relevant link to the registration specifically for your region. We do have multiple data servers and so forth throughout the world, and the one that is specific for India is the one that's listed here. And as a thank you to everybody here who does register, we have an initial voucher code that's listed here. I will share that as well with Dr. Atul, and the details will be available to him in order to bundle this accordingly with the various offers that he does have available to you. But first of all, thank you again so much. And we look forward into continuing the collaboration and support to everybody there. Thank you.
Thank you so much, Janice. In fact, I would say thank you, Dr. Simon. Today's webinar on a Sunday morning, people committing the time, we had a very good attendance. A lot more people want to come back who could not make it.
Thank you very much. It's been my pleasure, and happy World Optometry Day.
Thank you so much. Thank you.
Thank you.